And joining us now here on the program, we have with us the Associate Director of the Swine Health Information Center, Dr. Megan Niederwerder, is with us here today. And Dr. Niederwerder, appreciate the time. Thanks for joining us. How are you?
I'm doing well. Hey, thanks for having me.
Appreciate you being here. We have a lot to catch up on in regards to the Wean-to-Harvest Biosecurity Program from SCHC. And I think just before we get going, we've talked about this before, but let's remind some folks or catch them up on what is the Wean-to-Harvest Biosecurity Program.
Yes, over the last several months and even in some cases years, there have been data that has been generated from our swine disease reporting system, as well as our rapid response team that is funded by the Swine Health Information Center, that's really identified a need and a gap in biosecurity in the wean to market phase. And when we talk about that and some of the data that's been generated, it's really been shown that those grow finish facilities, the post-weaning phases, have much higher infection rates of diseases such as PRRS, PEDV, and even Actinobacillus pleuropneumoniae compared to, let's say, the sow or breeding farm facilities. And so when we started to identify that those age groups were becoming infected at a higher rate, we started looking at some of the biosecurity protocols and compared those to, let's say, the sow and breeding farm. And we have some gaps to fill in the biosecurity protocols in those older aged pigs in those production facilities, because what we were seeing is that there were facilities that were having lateral transmission, so essentially from one finishing site to the next. That was really associated with those outbreaks of Actinobacillus pleuropneumoniae in central Iowa last year. And so when we started identifying this data, identifying this gap, we started talking with our board of directors about how we could design a research program to really start to develop tools and technologies to fill those gaps in biosecurity. There's been biosecurity fatigue and protocols may not be implemented on a consistent level. How can we make it easier for daily farm employees to fulfill those biosecurity practices, because it's easy to do, it's cost effective, and it's implementable at every stage? And so that's really the rationale behind our development of this research program.
Well, Dr. Niederwerder, I know as well, this is a partnership with the nonprofit Foundation for Food and Agriculture Research and the Pork Checkoff. We should mention that as well.
Absolutely.
Let's move to talking about some of these priorities that have been defined now. And I know there's priorities both with site biosecurity and transportation. Let's start with the site biosecurity. Can you
Yes.
talk about some of those priorities that you guys have established?
Sure, yes. And so the research priorities have been developed with our task forces over the last several weeks. Those task forces were formed sort of as our phase one of this research program to say, we know there are gaps, but what are the highest research priorities that we need to be seeking out new tools for that will provide the greatest value to the industry? So we developed these task forces, both one for site and one for transport. And that involved veterinarians and producers and industry professionals, academics, and they allowed us to really define what those research priorities would be. So when we talk about the site research priorities, we talked about personnel biosecurity. And an example of that would be, are there alternatives that we could develop as opposed to the shower in and shower out protocols that are currently in place? One of the reasons for that is that not all grow finish facilities have showers. And the other aspect of that is that if the labor personnel are going from one barn to the next on the same site, perhaps a shower in, shower out is just not feasible in the middle of winter and going to multiple barns a day. And so how can we think about that differently, make it more effective to go into a new facility and go from facility to facility in a biosecure way, so that diseases are not being transmitted between sites. The other aspect of site biosecurity that we really started looking at is, can we think about a type of point of care diagnostic assay? So let's say you had just cleaned the pen and you had a diagnostic assay that could be attached to your iPhone, and you could take a swab and sample the pen, and a diagnostic test would say there's no pathogens detected, or there are still pathogens detected and you need to include another step in your cleaning process. So something like real-time sensing of contamination or cleanliness at the site level.
How about on the transportation side? I have to imagine a lot of that is going to revolve around the trucks that transport our pigs and the drivers as well.
Absolutely, yes. So the transport biosecurity site, or excuse me, task force was very helpful to, again, identify those areas in transportation and the trucks and trailers that are involved in transporting pigs to market, to the nursery, to the grow finish site, for rendering. So all of the transportation that's involved in our industry that makes pork production so efficient can also, of course, serve as a source of disease spread. So when we think about the transport priorities, one of the areas was looking at how do we clean and disinfect the non-pig contact areas. So that could be the cab of the truck, that could be the cubbies on the side of the truck, that could be the storage underneath the trailer, because oftentimes in the truck wash, those areas are not included. And so how can we develop a protocol or a tool that could allow those areas to be effectively cleaned and not serve as a source of disease? We also started talking about, what about how could we develop a mobile truck wash? And perhaps is there an ability for us to clean and disinfect the truck in the absence of water? So thinking about something like gas decontamination, or some sort of contact disinfectant that could be used after scrape or blowout of the trailer. Can we think about something mobile? Because in the case of a foreign animal disease outbreak or an endemic disease outbreak, if we could take the ability to clean and disinfect trucks to the farm, to the site where the infection is occurring, then we could effectively clean and disinfect those trucks at the site, again, reducing the likelihood of spread.
Well, I know as well, Dr. Niederwerder, all this research, not only this program, but all the research that you guys do with SHIC. I know folks can find a lot of that online. They can reach out to you guys if they have questions, if they need help. You guys have a lot of great resources available for our swine producers, don't you?
Yeah, so all of the information on the call for proposals is on our website, swinehealth.org. And then there is a Wean-to-Harvest Biosecurity link at the top of that website. You can click on that and then learn about the program, but also the call for proposals is included on that website. That really gives the researchers or anyone who is interested in submitting a proposal the instructions on how to do so, the template that you would fill in for a research proposal. Essentially, the research proposals, the budgets are capped at approximately $200,000. But if there is a justification for an industry-wide benefit or perhaps a multi-institutional project, they can provide that justification for an increase in the budget. We have an overall pool of $2.3 million for this research program, again, in collaboration with the Foundation for Food and Agriculture Research and the National Pork Checkoff. And the proposals are all due on December 16th of this year. So it's a fairly quick turnaround. And so I would encourage anyone who is interested in a proposal or in learning more information to look on that website and to see if they have any questions as they're preparing those research proposals.
Well, we appreciate the time and the thoughts as always. Real quick before we run out of time, anything else we haven't mentioned or any updates on some of those foreign animal diseases we're watching, Dr. Nina Werder?
Yeah, so we are continuing to monitor African swine fever virus throughout the world. The Dominican Republic has continued to have outbreaks with African swine fever. Although their percent positive of cases has gone down over the last several months compared to the initial outbreak. And so they're continuing to have positive cases, but are continuing to try and control those outbreaks and reduce, of course, disease spread on the country. We are also looking at this research program, the Wean-to-Harvest Biosecurity program, as an opportunity to not only reduce endemic disease pressure in those post-weaning phases, but also think about if a foreign animal disease was introduced, because we know that age group has higher infection rates of endemic diseases, it's fairly safe to assume that they're also at higher risk for potential foreign animal disease introduction, such as ASF. So if we can think about these tools and technologies, such as deploying mobile truck washes to a site, we can absolutely think about how that could provide value if African swine fever virus is introduced into the country, and utilizing some of those mobile technologies to contain any outbreak and eradicate any foreign animal disease as well as quickly as possible.
Fantastic. Well, again, folks can learn more online, swinehealth.org. With that, the Associate Director of the Swine Health Information Center, Dr. Megan Niederwerder. Appreciate the time. Thanks so much. We'll talk to you again soon.
Thanks for having me.